these slides that we will be viewing, we will begin with the normal histology of the lungs. So, how do you call those pointed spaces? The alveolar spaces. Now, what type of epithelium is lining the alveoli? Simple squamous epithelium. And then how do you call the connective tissue in between, situated or separating the alveolar spaces from each other? What is the specific name of that connective tissue? The interstitium or the interstitial tissue. So here, how will you describe the condition of the blood vessels in the interstitium? They are congested. So they are dilated and then they are filled with red blood cells. So indicating that there is a start of an inflammatory process in this lung tissue. Because what are the events involved in the development of an inflammation? What is that first vascular event? What are the cardinal manifestations of inflammation?
Vascular
Redness, swelling, heat. What is the cause of the redness and heat? Okay, first vascular event in inflammation is vasodilatation. Now, that is the appearance of the dilated blood vessels. After vasodilation, what follows? That will cause the redness. Because of vasodilatation, more blood will go to the inflamed area or to the injured area, so causing the development of redness. And because blood is warmer than other organs of the body, it will now produce the heat in inflammation. Now, what's the purpose of vasodilatation? If the lungs become infected, why will the blood vessels become dilated? Okay. To increase, what are the soldiers of our body that will combat the infection? The white blood cells, which are basically located in the blood. Now, to increase the delivery of white blood cells to the site of injury or to the site of infection, the blood vessels in the infected or injured organ will become dilated to increase the delivery of not the red cells but the white cells. And then after vasodilatation, what follows? Increased vascular permeability. What is the purpose of that event? To allow diapedesis, because the white blood cells are within the blood vessels, and then the injury or the infection occurs outside of the blood vessels. And that is why the blood vessels must allow the exit of the white blood cells from the confines of the vessel wall. How do you call that process of transmigration of the leukocytes across the wall of the white blood cells? The diapedesis. How about the movement of the leukocytes from the wall of the blood vessels towards the site of infection? Chemotaxis. They will become attracted to several chemoattractants or chemical attractants. Now, because of that increased vascular permeability, white blood cells are allowed to escape the confines of the blood vessel wall. The problem with increased vascular permeability is that the blood vessel wall will not only allow the exit of white blood cells, but what is the cause of tumor? Swelling and inflammation. What?
Accumulation of red blood cells.
Why will swelling develop in inflammation? Okay, increased vascular permeability pa rin. Aside from allowing exit of white blood cells, the holes in the blood vessel wall will also allow escape of water from the blood and become accumulated eventually into the tissues. That is why we are able to see interstitial tissues which are already thick, indicating that water has already accumulated in that pointed portion of the interstitial tissue. So normally, the interstitium should be that thin only, okay, to allow faster exchange of gases between the inspired air contained in the alveoli and the capillaries in the interstitium. The interstitial tissue should be that thin normally. So however, in that pointed portion, the interstitium is already markedly thickened because of edema developing in those pointed areas because of escape of water from the blood vessels. So basically, those are the mechanisms involved in the infectious disorders that we will be discussing subsequently. Now, for our first slide, this is labeled as cytomegalovirus pneumonia. Okay, for orientation. So that is those are the remaining patent alveolar spaces in this lung tissue. Notice that almost all alveolar spaces are already filled with materials which are not supposedly normally present in the alveolar space. So that pink amorphous material is actually the edema fluid, which has extended from the interstitial tissue, reaching eventually the alveolar spaces. So, what should be the clinical manifestation of this patient? This is cytomegalovirus pneumonia. Aside from coughing, what should be the predominant? Okay, because the alveolar spaces are already almost completely filled with edema fluid. Now, aside from edema fluid, the diagnosis of pneumonia is established because what is the microscopic finding in pneumonia? Pneumonia entails infection of the lungs, particularly the alveoli. So if that is an alveolar space, aside from containing edema fluid, there are already white blood cells inside the alveolar space. So those are the alveolar spaces. We are able to see neutrophils, and then those larger cells are the macrophages. So what are the stages of pneumonia? So congestion is the first stage, diba? Congestion which will result from increased vascular permeability, and then after increasing the vascular from vasodilatation, and then increased vascular permeability will follow. Congestion will be followed by what phase? Gray hepatization or red hepatization? Red hepatization. So that red hepatization stage actually results again from increased vascular permeability. So initially, what will be allowed to pass through in the blood vessels will be water. And then habang lumalaki ang butas sa wall ng mga blood vessels, the white blood cells will be allowed to escape from the blood vessels until eventually the red blood cells will also follow the white blood cells. That is why we are able to see those pointed red cells are actually the red blood cells, which are already present inside the alveolar spaces. Normally, they should be present only inside the capillaries. So, kaya tinawag na red hepatization. So, the alveolar spaces will be filled not only with white blood cells but also with red blood cells. So, ang gross appearance nito, parang liver na talaga. Because the alveolar spaces will become solid and firm because of the presence of the blood cells. Not only the white blood cells but also the red blood cells. That will now clinch the diagnosis of this condition. So these are the regular white blood cells. Notice their characteristic size. And then compare their size now to that pointed cell. Okay. So that cell is already markedly increased in size. So that cell is the one infected by the virus, the cytomegalovirus. So nag-produce ang cytopathic effect ng virus na yun is the enlargement of the infected cell. So mega means large. So kaya si Sharon Cuneta, mega star siya. So those are the abnormalities which you should be able to identify for this slide. Again, what can you say about those are also alveolar spaces which are already completely filled with red blood cells. Now, most likely the owner of this lab is a smoker because of the presence of those black carbon pigments. What is the specific name of for the black carbon pigments which are already in the tissues? Anong tawag? Anthracosis. Okay, identify the cells pointed. Alright, hemosiderin laden macrophages. Can we label them also in this condition as heart failure cells? No. So bilirubin comes from anong trabaho ng mga macrophages? Phagocytosis. Because the red cells are already present inside the alveolar spaces, they should not be present in the alveolar spaces. The immune system will now send the macrophages to phagocytose, the red blood cells, which have accumulated inside the alveolar spaces para to reestablish the patency of the alveolar spaces. Now, when the macrophages degrade the hemoglobin of the red cells that they have ingested, they will produce eventually bilirubin pigments. Thus, the development of the color, that specific color in the cytoplasm of the macrophages pointed. So this slide is diagnosed as candidiasis of the lungs. So the lung is infected with Candida albicans, and because of that infection, inflammation develops, which eventually leads into the development of that phase of pneumonia, which is pag mayroon ng red blood cells inside the alveolar spaces, the red hepatization stage of pneumonia. Let us look for fungal elements. Okay, ito, mild lang ang gun hepatization dito na alveolar spaces na yan. So, in that area, you can just imagine the degree of difficulty of breathing that the owner of that lung had. Balikan na lang natin itong slide na ito to look for the fungal elements. So in the practical exam, kung yan lang maglabas, what should be your diagnosis? Ano? No, wala tayong nakitang evidence of fungal infection. Again, pneumonia in red hepatization stage. Balikan lang natin itong candidiasis na slide. Maubos ang oras natin. Now, you have already seen this slide in the inflammation chapter. Okay? This type of infection will characteristically produce that type of necrosis. How will you call that? The caseous necrosis. And then surrounding the area of caseous necrosis is what type of inflammation? Ano? Granulomatous inflammation. No. That is caseous necrosis area immediately surrounding the caseous necrosis is a focus of a ring of granulomatous inflammation. How will you define granulomatous inflammation? What is the characteristic infiltrate in granulomatous inflammation? Langhans may be formed. Those are the Langhans type giant cells. So, however, Langhans may not be present in a granulomatous inflammation. What is the definition of a granulomatous inflammation? Is a chronic inflammation which is characterized by the presence of what? Infiltrate. Lymphocytes may be present, but then the characteristic feature of that type of inflammation are those cells pointed. Ano siya? Ang tawag sa kanila? Epithelioid macrophages. Tinawag silang epithelioid macrophages because they will assume an appearance which is almost similar with the appearance of the epithelial cells, particularly the squamous cells. Now, why will they have that characteristic appearance? Another name for epithelioid macrophages is last year pa kasi yung last sem pa yung information. Another name for epithelioid macrophages is activated macrophages. So once they become activated, they will increase their number of organelles. So what is the function of the macrophages? Phagocytosis. After phagocytosing a microorganism, how will the macrophages kill the phagocytosed microorganism? What will fuse to the phagosome? Lysosomes. What are contained in the lysosomes? Enzymes and reactive oxygen species. The enzymes are basically composed of proteins. Anong organelles nag-produce ng proteins? Ano? Rough endoplasmic reticulum is involved, Golgi apparatus. Now, once the macrophages become activated, they will increase enzyme production, their enzyme production. Because of that, the organelles involved in enzyme synthesis and reactive oxygen species synthesis will also become increased in number, thus the increase in the size of the cytoplasm of the activated macrophages. Okay? So some macrophages, in order to limit the spread of the pathogen, they will fuse with each other to form the inflammatory giant cells. Now, based on the appearance of that cell, Can we call that as a Langhans type giant cell? Ano yung isang type of inflammatory giant cell? Foreign body. Now, based on the appearance, how should we call that giant cell? Foreign body. Yan ang characteristic na Langhans type giant cell. However, the previous giant cell pointed, was still a Langhans type giant cell. So, tangential yon. Kunyari, ito yung giant cell. Giant cell. So, circumferential ang arrangement in the periphery of the cytoplasm ng mga nuclei. So, maganda lang pag makat sa central portion ng cell, because we will be able to see the peripheral location of the nuclei. Yung kanina, sa side, tangential to the side of the cell, that is why halos na sa gitna na rin yung ibang nucleus. Okay, aside from epithelioid cells, we will be able to see also those smaller cells pointed, which are the ano sila? If those are the epithelioid cells, those are the lymphocytes. Now, what will activate the macrophages? In what type of hypersensitivity reaction is involved in tuberculosis? Type 4. Now, activated macrophages. What will activate the macrophages? The Pura bang nag-lecture niyan sa Sa microbiome sa immunity? Those cells will activate the macrophages. They are the CD, very good, the CD4 macrophages. So they will activate CD4 lymphocytes. They will activate the macrophages. Now, tuberculosis is classified as hypersensitivity reaction. It's a hypersensitivity reaction. The tissue destruction will result not from the effect of the microorganism, but from the response of the immune system. Now, the destruction of the lungs or any organ infected with TB will result into the development of production of necrosis, which is a manifestation of tissue destruction in tuberculosis. What will cause the development of necrosis in tuberculosis? Is it a result of the direct action of the Mycobacterium tuberculosis? No, it is from the response of the immune system. Bakit nagkakaroon ng necrosis? What is the mechanism involved? From pwede na ganon. However, we were not able to see any neutrophils. So remember, granulomatous inflammation is characterized by the presence of epithelioid macrophages, which will be rimmed by the lymphocytes. Aside from CD4 lymphocyte, what is that other subpopulation of lymphocyte that will be involved in granulomatous inflammation in tuberculosis? CD8 lymphocytes. What is the other name of that lymphocyte? Cytotoxic lymphocyte. Now, tinawag siyang cytotoxic because it will produce chemicals that is toxic to other cells of the body. Okay? Its function is actually to kill. Anong pinapatay ng mga CD8 lymphocytes? Okay, tumor cells and not the virus themselves, but the virally infected cells. Now, in the case of TB, the macrophages may seemingly become also infected by the TB bacilli. Because initially, after phagocytosing the TB bacilli, will the macrophages immediately be capable of killing the phagocytosed TB bacilli? Hindi muna nila mapapatay. That is why they will present the antigens of the bacilli to CD4 lymphocytes via what class of MHC molecule? Class 2. Okay? So, from the macrophages, the antigens will be presented to the CD4 lymphocytes, and then the CD4 lymphocytes, being the master regulator of the immune system, will respond by releasing cytokines that will activate the macrophages to produce the necessary enzymes that will allow the macrophages to kill the phagocytosed bacilli. And then aside from that, the CD4 lymphocytes will also activate the CD8 lymphocytes. The CD8 lymphocytes will kill ano yung na-infect na cell? Will kill the macrophages. So, isa-sacrifice ngayon ng CD8 lymphocytes sa mga macrophages harboring the TB bacilli. Pag namatay na yung macrophages, the contents of the lysosome of the dead macrophages will be released to the extracellular space, released outside of the macrophages. Any tissue that will be exposed to the enzymes of the dead macrophages and then the reactive oxygen species of the macrophages will die, thus the development of necrosis in TB. So the TB bacilli themselves do not cause the tissue destruction, but the response of the immune system. Thus tuberculosis is classified as a hypersensitivity disease. So what can you say about the activity of the person owning the owner of this lab? Smoker pa rin. Kaya siguro nag-develop siya ng tuberculosis. How will you describe the pointed vessel? Dilated and congested. So, malalaman natin, although not completely filled, ang isang vessel, if it is congested, if we are able to see red blood cells near the wall of the blood vessel already. Because normally, the blood cells are present in the middle portion of the blood vessels, producing what type of flow? Normal flow? Laminar flow. That is to prevent friction between the wall of the blood vessels and the passing blood cells. Our next slide is diagnosed as acute bronchopneumonia. So, kung yan lang ipakita ng diagnosis natin, are those cells pointed normally present in the alveolar spaces? No. So, kung yan lang ipakita ng diagnosis natin, pneumonia in red hepatization. Now, the stain of this slide is already very faint. So, because those cells pointed actually possess nucleus. Ito ang normal na red blood cells. Yan sila, na mayroong nuclei, they are the white blood cells already. Actually, they are neutrophils. So, if neutrophils are seen, what type of inflammation is occurring? Acute or chronic? Acute. So, kaya ang diagnosis dito, acute pneumonia. Kung yan lang ha. However, this slide is labeled as acute bronchopneumonia, indicating the presence of acute inflammation in the bronchi also. Okay, what is the specific name of the airway pointed? It is lined by a pseudostratified columnar epithelium. It possesses smooth muscle fibers in its wall. However, there are no plates of hyaline cartilage. So that is a bronchiole. Terminal or respiratory? Bakit terminal? Ano? Complete ang circumference niya. Wala siyang alveolar spaces sa wall. So that is another bronchiole. The wall of that bronchiole is also infiltrated by white blood cells, indicating that that bronchiole is also inflamed. So that's the diagnosis of bronchopneumonia. So the alveolar spaces, the alveoli are inflamed, including the bronchi, the bronchioles. So yan din, na airway na yan. Its wall is also acutely inflamed. Those cells are not red blood cells, but they are neutrophils. So, masyado nang matanda kasi itong slide na ito, nag-faint na yung hematoxylin stain niya. So, if that portion of this slide is shown in the practical exam, the diagnosis should be acute bronchopneumonia. Pero pag yan lang, pneumonia lang. Acute pneumonia. Pag yan lang. Because there are red blood cells and white blood cells inside the alveolar spaces. Most likely, the cause of this infection is a virus. What can you say about the condition of the alveolar spaces in comparison with the previous slides that we have discussed? How will you describe the appearance of the alveolar spaces? Is there any cellular element present? None. However, the problem is the interstitium. So, how will you describe now the interstitium? How about the condition of the blood vessels? Congested. How about the thickness? Okay, thick because of edema, and those pointed cells should be inside the blood vessels. Those are the white blood cells. Okay, leukocytic infiltration and edema of the interstitial tissue. That is why this condition is called interstitial pneumonia. So most of the time, interstitial pneumonia is caused by viruses and atypical bacteria. What is an example of an atypical bacteria? Ano? Very good. Mycoplasma pneumoniae. Okay? So those are bronchioles. Notice that their wall is not infiltrated by white blood cells. Unlike kanina sa acute bronchopneumonia, the wall of the bronchioles is infiltrated by leukocytes. Dito malinis ang wall. So the problem is confined to the interstitium of the alveoli. So malinis ang alveolar spaces. So will this patient also develop dyspnea? What will happen to the oxygen concentration in the blood of this patient? Mag-decrease pa rin because nag-increase ang thickness ng interstitial septum there will also be an impediment in the oxygenation of blood. Eventually, if left untreated, there will be further increase in vascular permeability, so that aside from edema being confined in the interstitial tissue, edema will eventually develop in the alveolar spaces. Okay? Yan, that is in the histologic appearance of alveolar edema. Mayroong pink materials inside the alveolar spaces. So, madali lang ito masyadong i-diagnose because the alveolar spaces are clean. So, unlike in bacterial pneumonia, wherein the infiltrates, the leukocytic infiltrates are, and the red blood cells are within the alveolar spaces. Our next slide is labeled as histoplasmosis. So, histoplasma is an example of what organism? A fungus. Okay, kung yan ay ipakita sa practical exam, what should be the diagnosis? Pneumonia. Balikan lang din natin itong slide na ito to look for the fungal elements. So next slide is also another fungal infection, coccidioidomycosis. So same with previous slide, histoplasmosis and inflammation in the lungs will also develop, leading into the development of pneumonia. Ito na portion, may TB din ito. Caseous necrosis with surrounding granulomatous inflammation. Most of the time, fungal infections in the internal organs are rarely seen. They will develop only in the internal organs. The fungal infections will only develop in the internal organs if the individual is immunocompromised. Otherwise, most fungal infections will develop only in the integumentary system. Mga tinnias and athlete's foot. Balikan lang po natin yung next slide. Problematic na yung mga kuan ay fungal infections. The next slide is labeled as tuberculosis with aspergillosis. Okay, this area shown exhibits yung naka-point na yan. What should be your diagnosis? Anthracosis. How about that area? Mayroong caseous necrosis, mayroong granulomatous inflammation surrounding the caseous necrosis. So that part is the tuberculosis portion. Ito. Yan na ngayon yung mga fungal spores and hyphae. So, the round ones are the spores, and then yung mga elongated structures, they are the hyphae. So, for orientation, para malocate ninyo ito mamaya, pag kayo na lang mag-study. So, ito yung lung tissue, which has developed tuberculosis. Okay, actually, the fungus, tinawag itong aspergilloma because it has produced a tumor-like structure or a mass in the lungs. So, and then that mass is composed of the fungal elements. Ayan, yan. So, on scanning objective view, on low power magnification, and then on high power magnification, you will now be able to see the details of the fungus ball, which is actually composed of the fungal spores, and then the elongated structures are the fungal hyphae. You can just imagine the rate of multiplication of these fungal elements. Tuberculosis with aspergilloma. Now, our next slide is diagnosed as Pneumocystis carinii pneumonia. Now, this is specially stained to demonstrate the causative agent, Pneumocystis carinii. Have you discussed this parasite already in parasitology? Okay, so those are the protozoans, Pneumocystis carinii. So it will now be the assignment of everybody, including me, to read on the specific name of this particular stage of the protozoan, Pneumocystis carinii. So, yan, they have infiltrated the tissues of the lungs. Pneumocystis carinii, and then you should be able to differentiate them from tawag niyan, yung black carbon pigments, anthracosis, kasi on high power magnification mayroon silang shade. Okay. So round to oval. So your assignment is to read on the specific name of that phase of the causative agent, or states of the life cycle of the causative agent. Our next slide is labeled as good pasture syndrome. So aside from affecting the lungs, what is the other organ or area of the body that is involved in good pastures? So the kidneys will also become affected. Now, characteristic feature of the abnormality of this slide is the presence of the red blood cells inside the alveolar spaces. Why will the red blood cells escape the blood vessels in good pastures? What particular organ is affected in tissue is affected in good pastures? Ano? Okay, the blood vessel wall. There is necrosis of the blood vessel wall. Because of that necrosis, eventually the blood vessel will rupture, leading into the escape of the blood vessel of the blood cells. And this is why the blood cells, the red blood cells, white blood cells will become accumulated in the alveolar spaces. What will cause the destruction? Nagkakaroon ng vasculitis, necrotic vasculitis because of the attack of, very good, anti-basement membrane autoantibodies. Now, if the antibodies have already attached themselves to the basement membrane of the blood vessel wall, why will the blood vessel wall become destroyed? So, naka-attach na ngayon doon yung antibody sa wall ng blood vessels, particularly in the basement membrane. Bakit masisira ang wall ng blood vessel? I-attack siya ng, very good, the complement proteins will become fixated and activated in the wall of the blood vessels. What particular component of the complement system will cause the destruction of the cells composing the wall of the blood vessels? A membrane attack complex. Hopefully, you can still remember how the membrane attack complex will cause the death of the cells na kung saan naka-attach sila. So, characteristic problem in this slide, accumulation of the red blood cells inside the alveolar spaces, and then saan na yung mayroong vasculitis kanina? Okay, that should be a blood vessel. Let us zoom into it. Okay. In the lumen is already markedly distorted, so it is still, the lumen of the blood vessel is still filled with red blood cells. However, the wall is already infiltrated by white blood cells. So, indicating that blood vessel is already inflamed. Yeah. Vasculitis na ngayon. So, what will cause the infiltration of the white blood cells in the blood vessel wall? Pag naka-attach na ang antibodies sa wall ng blood vessel, particularly in the basement membrane, what will recruit? The leukocytes. Very good. Again, the activation of the complement system, CCV particularly, will recruit the white blood cells and become infiltrated to the wall of the blood vessels. So, vasculitis and then extravasated red blood cells. Red blood cells which are already released from the blood vessel wall. Good pastures. Okay, we will continue this next meeting naman. So, you may now study on your own.
Kanila? Asa, kanila? Ay, kanila.